Welcome, Sarah, our osteopath, and thank you so much for being here tonight. And I'd love for you to be able to just share a little bit about what you do and who you are and what information we can take on board as people that work with pregnant mums with children. So, antenatally and postnatally, how the stuff that you do helps. So I'll pass it over to you.
Okay. Hi, I'm Sarah. I'm a osteopath of I think 8 years now, maybe a bit more, 9 years. I'm also a mum of 2. In the last, 5+ years, I've been specialising more in pregnancy osteopathy, but just starting with what is an osteopath, because some people know, some people don't. So an osteopath is a form of physical therapy, kind of similar to a physio or a chiropractor, but we treat holistically. So we look at the whole person. So whether you've come for a headache, back pain, even within the case history, it's not just tell me about the headaches, it's tell me about your sleep, your stress, then extra obviously questions about pregnancy and medical and things like that to rule out all the other stuff as well. And then through treatment, it's not just the head and the neck, it's the head, the neck, the upper back, the lower back, especially important when you're treating a pregnant woman, because obviously pregnancy affects the whole body. So our point of difference is just treating the whole body, the whole person, whether that's lifestyle factors, physical factors, not just isolated to where a patient might feel it. And then physios more targeted to an area. So if you go to them for pubic joint pain, SPD, they will generally just treat the pelvis and the lower back, but they're really good at targeted exercises. So I personally work a lot with a women's physio in my clinic, and Sarah and myself often see a lot of patients together different times, because she brings something else. Like, she does internal work for some women where appropriate. She is really good at targeted exercises for the whatever it may be, whether it's sacroiliac joint, sciatica, SPD, whatever. So she's probably better at that than me, so I kind of leave that to her, and then I sort of do more the hands-on physical therapy side of it. A chiropractor is different again, where they more treat the spine and just do manipulation, where I do a little bit of manipulation depending on the person, depending on where I feel they need it, and also age appropriate. I wouldn't be doing that to an older person or quite a young person either. And then chiropractors sometimes do a little bit of massage work, and same with the physio. Some are purely hands-off, they're all exercise-based and purely exercise rehab. Some do a little bit of physical therapy with exercise, so they do vary a bit. But yeah, that's kind of the point of difference between that. But we all kind of complement each other as well. And my thing I always say with patients is, give it a go with me, and then we'll give it a couple of sessions, and each session is more, you reassess, and there's no kind of, you've come in for headaches, okay, well, I want to see you once a week for 6 weeks. It's very tailored to the person, the stage of pregnancy or general person. Generally see you once, and then if they're not really acute, we'll see you once again in a week, and then depends how that person responds to treatment as to how frequent. Especially with pregnancy, generally earlier in pregnancy, you can get on top of issues like sciatica or the pubic joint, and then have a much better success. In those last trimester, those last 4 weeks, obviously the woman's at her biggest. There's a lot of postural changes and things like that have gone on. So it's a little bit harder sometimes to get on top of that. And it's more about symptom management. So that may become a bit more weekly for that person. But again, it's entirely lifestyle dependent, what they're doing for a job, or are they at home? Are they looking after young children? Or is it their first pregnancy and they're a lot younger? They're going to respond better to treatment as well. What we treat is quite broad. So from top down, headaches, migraines, shoulder pain, a woman today with carpal tunnels, so the pins and needles and the swelling from fluid retention in pregnancy. We treat a lot of that.
Yeah, I had that through both.
Yeah, and even, for example,
my girls' pregnancies. Apparently, it doesn't happen for boy pregnancies. It's more like to happen for girls.
Yeah.
So, and I didn't know. I was just given some wristbands for my hands. I didn't know that osteopathy could help with that.
And again, it all ties into that lymphatic drainage. So for my lady that exactly had that today, she's 38 and a half weeks pregnant and she'll be giving birth in the next week. So for her, the biggest thing is obviously delivery, because then your body can then start processing that fluid and expel it. But for me, it's thinking about that lymphatic drainage of the entire upper limb, the neck, the back, the ribs, the muscles in the arm, through the wrist. Are they all too tight, or are they moving quite well, to aid the body as much as possible? For that person, also, I gave her compression to wear over her hands and forearms. And then today I gave her some exercises, elevating her hands and pumping them, just trying to help with that drainage. Ultimately, delivery will most times fix the problem. So that is an example of symptom management more than being able to fully get rid of it. But for her, that is actually helping. Obviously not completely, but they're a lot less painful, a lot less pins and needles, and just some tips and tricks on her sleeping posture at night, just to trying to avoid compression and things as well. Other issues, back pain, whether that's upper back, lower back pain, hip pain. So for women, especially for those that don't typically sleep on their sides, getting used to side sleeping, often those women get quite sore in the outer of the hip. One tip and trick in there is getting a normal pillow, like a sleeping one you put behind your head, and turning it sideways and sleeping on the pillow. So the pillow then covers the ribs, the belly, and the hip. And especially in that later part of pregnancy, that takes the pressure off the hip. It helps take the weight of the belly, and then it just supports the rib cage as well, just to put a bit more padding in through there. Hip pain in general, and then restless legs, women can get as well. And just tips for that. Sciatica. True sciatica, not really, because it comes from the spine, where most often it's normally more things like piriformis syndrome. So where that sciatic nerve comes out of the lower back, goes down through the glutes and then down the back of the leg. And that true sciatica goes past the knee, and it's pins and needles, numbness. It's a neurological, not just a pain. That's a pain referral, which is a different, same at the end of the day. But yeah. And sort of left anything out. The pubic joints, so pelvis at the back, so you've got the sacroiliac joints at the back, they can cause pain. And then around the front of the pelvis, you've got the pubic joint, which naturally, so there's a little disc in the middle, and then naturally with pregnancy, that separates 3 to 7 mils. But for some women, that stretches more. Then you've got the adductor muscles, the inner thighs, they then pull on the joint. So often with treatment, just loosening all through there can be really helpful and supportive. Another common thing is your sort of tailbone pain, which can also come up after delivery as well. The biggest piece of advice is just buying one of those cheap, from the $2 shop, one of those like travel neck pillows, and sitting on that. So the actual coccyx tailbone is in the center, and the rest of the U is on your sitting bones, your bottom. So the direct, because it's often sitting, and especially on a hard surface, it puts pressure on that coccyx bone. So by sitting on that softer surface, those travel pillows are perfect, because then the bone's then floating rather than actually touching the chair. So that works quite well. I'm talking quite fast.
Can I ask you something, Sarah?
Yes.
Sorry.
Yeah, of course.
I broke my coccyx twice giving birth. And I have been, I have been recommended exactly the same, the pillow. But how that affect, how that affect the pelvic floor? Like, when you sit on that pillow, because it has a hole, kind of like it doesn't support very well the pelvic floor. And is that something that could affect probably to, I don't know, in case of prolapse or something like that, to make it worse?
No, because when you sit on a normal chair, like your pelvic floor is nowhere near the surface of a chair, unless you really have a prolapse and it's actually outside the pelvis, of which you'd need to see a pelvic physio and then even a specialist to see, depending on the degree of it, and whether you could do pelvic floor exercises and rings and lift it back up, or whether you'd need surgical intervention. I wonder even if sitting on a travel pillow would be better, because because it's slightly unstable relative to sitting dead still. If anything, it would engage the pelvis more. It would actually help lift up rather than actually turn it off. But because the pelvis and the bones, like, it's actually up inside it, so it's not just loosely hanging, well, unless it's a full prolapse. But even then, it's not the pelvic floor that's come out. It's normally an organ.
Yeah.
Yeah. That answers the question.
Thank you.
That's right. Round ligament pain. So for the uterus and the ligaments, again, it's a normal, same as the pubic joint. It's a normal, it's like a growing pain effectively. So those ligaments, when they stretch and everything's getting bigger, it's a stretching pain, which some women get, some women don't. And generally a nice wheat bag in that area is quite nice as well. It's probably all the most common things. More systemic-y things we can see is your reflux for some women, just from that extra, obviously the baby in the belly, there's more fluid, and so that abdominal cavity gets quite compressed. And so, which obviously then is forcing the stomach upwards, which means that acid reflux. But on top of that, also the relaxin hormone. So the stomach fundus at the top has a sphincter, which holds it closed. And because of the relaxin hormone, it makes that valve or sphincter loose, floppy, and therefore the acid can travel back up as a consequence of pregnancy. So the best advice for reflux is small meals often, also eating dinner really early, ideally 5 to 6 p.m, and then staying upright for as long as possible after dinner. So having an early dinner and then sitting up on the couch, sitting up in bed. And the point of sitting upright is you have gravity helping you and keeping that acid down for as long as possible. Otherwise, you eat dinner, you go lie down on the couch, and then within an hour or so, you've got that burning, awful sensation coming back up again. Also sleeping side lying, but kind of upright. So instead of just having one or two pillows, having kind of two pillows under your head and then like another one a little bit lower. So you're lying on your side, but you're still half upright. Again, so when you're sleeping, you've got gravity trying to keep that acid down if possible. Another one's constipation, and that ties in again with that relaxin hormone, because at the end of the day, the intestines are still a muscle. And the whole point of the relaxin hormone in pregnancy is to allow the body to expand, and that's why your rib cage expands, your pelvis expands. Unfortunately, it's not limited to where it's needed, and it affects all muscles and joints. And so as the bowel is a muscle, it can become, for some women, it becomes quite lazy. And that is why constipation can occur, and side effects of some medication. For example, if you have reflux and you're on omeprazole for a long period of time, or some anti-nausea, that can also, or another big one is iron. So being on ferrograde or ferritab, which is one of the most common iron supplements given in New Zealand, that can also quite commonly cause constipation. Of which, if that is the cause, and if it is medication, it's asking the woman to speak to her midwife, obstetrician, doctor, if there's an alternative, or if it's iron, for example, how long she's been taking it, when was her iron last tested, can we retest it, is it at a better level where we can drop her down to every second or third day, once a week, does she need to be taking it, or an alternative. And also just obviously eating red meat if they're vegetarian, eating lots of greens with vitamin C. So just taking the same problem, but just addressing it differently to try avoid other consequences, because especially constipation in that third trimester, you run the risk of hemorrhoids, which you don't want to do. So especially with all that then weight of the baby in the pelvis, if you're constipated, it just doesn't all go together particularly
It's so
well.
interesting, Sarah.
Yep.
So can I just
Mm.
ask, with
Yep.
all that relaxin and with constipation and things like that, do you do anything like hands-on for that, or would you just give her similar advice to what you're giving? So is there anything that you would manipulate or do if somebody was?
Yeah, so like for a patient coming to me with reflux, it's a lot of the lifestyle advice, avoiding food triggers like coffee, chocolate, spicy food, acidic foods, a lot of the advice on posture and when to eat and things like that. But also for me, structurally treating her, loosening up the rib cage, loosening up her upper back, her lower back, the diaphragm, all the intercostal muscles. So physically taking as much structural pressure off the internal organ as possible, and making everything move better. So at least you've tried to take that structural element out of reflux. Sometimes is enough for some people. Other people, it's very much more of a hormonal component than a structural component. So that same with constipation, making sure the hips are working well, the lower back's working well, lots of education on water, fiber, going for walks every day, seeing a nutritionist if possible. Is constipation just a pregnancy thing for them, or a lot of people do not poo once or twice a day, ideally twice a day. A lot of people do only poo every second or third day, or sometimes worse, which isn't good for your body at all, but surprising when you start asking people. And that's down to bowel habits. One good tip for constipation in pregnancy is women, to be fair, this applies to all adults and children, it's not limited to pregnancy, but when you're sitting on the toilet, having your feet on a stool, doesn't matter if it's the rubbish bin, you got your foot on the lid, or it's a kid's stool, or whatever it is, but the point being that your hips are higher than your pelvis, and that just helps change the orientation of the pelvis, especially after birth. This is quite nice as well, which takes the pressure off that bowel and just really helps with those stools coming out much smoother and less painful, and a lot less pressure, and the woman's not having to force down, especially on that pelvic floor as well. With that, any other questions, but I keep moving on? Think it?
No, I was just wanting to know because about like the relaxin. Well, for some mums also, when they feel the effects of relaxin in terms of feeling really stiff. And I have very strong memories of this. I would sit down for like 20 minutes, 30 minutes. I'd go to move and I'd feel like it's 105, literally. It was just so hard. My hips, my lower back, really super, super tight. Is that something that you can help with?
Absolutely. Yeah, just general tightness.
I didn't go to anyone. I just sucked it up. But anyway, so you would actually manipulate and loosen things. Yeah,
absolutely. When to see an osteopath? Anytime. There's nothing I can do that would ever conflict or cause, which is another topic in itself which I'll talk about, but I see women right from when they first got pregnant, right up to the day of birth. There's nothing I could do that would cause any, I'm not going to jump up and down on your belly or anything crazy like that. There's nothing osteopathically we do that wouldn't be safe at any point. Treated woman the day they happen to go into labour that afternoon, that's absolutely fine. When to see an osteopath after labour, this is very person dependent and depending on how that labour goes. Obviously a C-section you can't drive straight away, but in saying that, I've treated women a few days later after a C-section once they've got home, they're like, oh, my lower back is just really sore. So in that case, then I would never treat around the scar and around the front of the belly, but there's nothing wrong with me treating the back and the neck and the hips and everything else around it. So that really just depends on the person. And I just say, when you're feeling comfortable, you're welcome to bring baby with you and a support person or leave them in the pram, whatever, that's more than fine. That's entirely up to the mum. So, yeah.
Sorry, quick question just while you're on the subject. What things do you typically treat postpartum? Like pregnancy related postpartum things, I guess is what I'm asking. Not just, I've gotten back to my usual like neck things or whatever sort this or
A little bit of birth trauma, it depends. A friend actually messaged me last night, and go back to that tailbone, she said, after 2 pregnancies, that pain's just never gone away, and she's never seen anyone about it. So especially with, the baby coming through the birth, if they go through the birth canal, the coccyx and the sacrum, and that has to move, and kind of the way the body moves is you deliver the baby. So it can be related to birth trauma, but it's not necessarily related to the pelvis and the baby coming out. It might be, I had my legs up for ages, and now my right leg feels all jammed up, or my lower back's a bit sore, or I sat for ages and on all fours on the bed, and I'm really stiff and sore from that now. So trauma doesn't necessarily mean horrific and awful. It's just been through the process. Generally speaking, most people, if I've seen you for rib pain or the sciatica you've got, or pubic joint pain, or whatever that may be, often I say you push out the pain. And typically once you've given birth, because of the weight of the baby's gone, all those fluids have gone, most of like the relaxant hormones, so a lot of things start to settle down. Obviously then you've got different things from feeding and that, but most often pregnancy pains disappear. Some people have new aches and pains relating to birth. And then other postnatal women, like one today, hers was actually jaw pain. I was talking to Helen about this morning, and because she had a lot of issues relating to breastfeeding. So tried lactation consultants, lip tie, tongue tie. It was all just quite traumatic. And after a week and a half, she just gave up, which was fair enough. She'd seen enough people by that point and changed a formula, but she still just had so much jaw tension from clenching, anxiety, already suffered from anxiety. So that was what I'm treating her for at the moment. But it's a range of neck, back, just injuries relating to, especially first-time mums, just how differently you use your body as a mother. Like I can't, it's when my kids are 7.5 and almost 5 now, but when they're young, you're always on your knees, you're bending over, picking them up, you're changing them on the floor. A lot of things that you wouldn't normally, most adults don't normally sit on the floor. You don't kneel on the floor. It's not until you're a parent. I treated a dad yesterday, and his was picking up his daughter, 9-month-old, and went to lie her on the bed to change her nappy, and then his lower back seized up. So this isn't just mums now, it's parenting puts different challenges on the body that most of us aren't used to, especially if you have quite a sedentary desk job. It's quite physical, lifting prams, blah, blah, blah. So it more relates to just adapting to parenthood, plus being tired, plus being waking at night time. I try support breastfeeding or even bottle feeding women, just with, again, that advice around posture. When you're feeding, or like breastfeeding, for example, where's your arm? Do you have pillows? Are you in a good chair? Are you sitting back, or are you leaning forward? Are you playing on your phone the whole time? And that's not great for your neck if you're there for an hour. Just all those little things, and just helping them through it, and then working alongside lactation consultants, and again, our pelvic floor physio, and just supporting women through that journey into parenthood. Yeah.
Do you treat the babies?
Personally, I don't treat babies because at uni we just didn't do enough on babies in terms of their developmental milestones and things like that. So I personally only treat over 5 years old. But in saying that, I have an amazing osteopath that works in our clinic who does treat babies, and she's a cranial osteopath. Yeah. So mine's very structural, moving joints around, soft tissue work, etc., etc. Cranial is osteopathy is based on a different principle. So it's about it's light, gentle hold on the head and body, and it's based on the CSF, so cerebral spinal fluid, and that sort of pumping, flexion, extension movement. And theirs is more guiding the body to sort of unwind itself and unrestrict itself in terms of the cranial bones and things like that. But osteopathy cranial osteopathy for young babies works really well. So for example, my 2-year-old at the time had recurrent ear infections, and Jill treated him, and touch wood, we have not had an ear infection since, and that was someone on 3 weekly antibiotics when he was really little. So yes.
Yeah, I can remember many years ago, just watching a program about that, and the profound benefits there were to babies that were having some real difficulties with the feeding, the sleeping, the settling. And it didn't take a lot of treatment to make quite a significant impact and change. Yeah, that's why I asked you, because you think about the mums and you say go through a lot, but those poor bubbies go through a lot too. So
absolutely. Yeah, absolutely. And it's as a parent watching, you're kind of like, what am I paying for? Like, she's just literally just holding them. It doesn't look like anything, especially compared to what I do, because it looks, you can see I'm quite clearly doing things, but it does work. Whether it's unsettled babies, reflux, colic, sleeping issues, tongue-tie issues, if they've got torticollis, so one of the SEMs is locked, or they favor turning their heads one way, or if their hips aren't right, obviously that needs full checking by a specialist for hip dysplasia. But babies, especially when they've come through that birth canal, might not come out symmetrical. One part of the head might be a little bit flat. So there's a lot of little things that can come up in children, which osteopathy can work really well. And it's very light, gentle. It's not anything invasive or anything like that. Yeah.
Awesome. Can I ask, Sarah, do you do any work with women who have got babies in a breech position?
I'm going to talk about that. I'll answer it with the word no, because same with transverse breech posterior. My thoughts on it, and my sisters are midwives have had good chats about this, that it's actually dangerous, and it's very dangerous for someone to try claim that they can turn babies, because I'm more of the thought that they're like that for a reason. I will definitely say, yep, I actually recommend having a treatment, 1 or 2 between 36 and 40 weeks, for the purpose of loosening the lower back, loosening the hips, making sure that pelvis is working as well as possible, the rib cage, giving as much space as possible, and getting the area working as well as it can be functionally, which gives the baby the chance to move. So I help the mother as much as I can. That gives the baby the chance to move. Whether it then does, that's awesome. Whether I would ever claim, yes, you can walk in with a breech baby and you'll walk out with a normal, absolutely not.
I don't think anyone can. Nobody can.
No. And also because it's dangerous in the sense of, why are they breech? Why are they transverse? Where's the cord? Like if you try claim that, yes, you can move them, it has to be done in hospital. It has to be done with midwives and obstetricians. It's often done under an ultrasound. It is brutally painful. And then it's not even always successful. There's many stories of people go in, they have it, and literally walk into the car park, they can feel it flip. And also it depends where you're at in pregnancy. Like my first child, Ryan, he was breech until he was 36 weeks. He was still a C-section anyway, so it was irrelevant. But, he changed position all by himself at the end. And yeah, like there's definitely like spinning babies and yoga moves and things you can do, which are absolutely safe and totally recommended to do. But in terms of turning babies, I would never claim. I'd say I can do what I've said. I can help get things working as well as possible.
That's kind of actually more where I was going with that question. It wasn't do you turn them, but can you help facilitate the body so it's in its best optimal state to turn, which I guess that's, you're working on the body. What the baby does is up to the baby. And that's, which is kind of what we do in hypnobirthing or hypnotherapy, is that we facilitate the mind to be open to the idea that baby can move. And if the baby wants to move, the baby can move.
Yeah, totally. Just the same as if someone asked me, can I induce labour or do anything to help with labour? I've been asked that before. And I'm very much, the baby will do what it wants to do. If the baby's ready, then the baby will come. Again, I'll do the same thing, make sure everything's working as well as possible. But luckily I cannot induce labour because I treat women right from when they've just conceived and are only 4 or 5 weeks. So I hope I can't induce labour. But yeah, again, it's, if a baby's ready, they're ready. If they're not, they're not. I was induced with Ryan because I had preeclampsia. And with that 3-day induction, he never engaged. He never went anywhere near my pelvis. He just, and that's why I'm very much, yeah, you can't. Yeah.
Nice. That's
Any
heaps of
other?
information.
Yeah. General tips in pregnancy. Pillows I've sort of talked about a little bit. So for women suffering with, say, pelvic pain, pubic joint pain, I say, and this is a bit odd for some women, is getting like a normal decorative pillow off the couch, or a little pillow, and then putting it between your knees, and this is the bit that's a bit weird, is getting the tie, off your dressing gown or a TheraBand or whatever. So pillow between the knees, and then loosely tying your legs together. Obviously not tight, because you can't cut circulation off, but it just means, like, typically women with pubic joint pain in the front there, they'll say, I wake up every time I have to roll over, I wake myself up because my pelvis hurts. And what's happening is that pubic joint, when you're rolling over one leg at a time, you're opening that joint right up, and that's stretching it, and that's what's creating the pain. Some women swear by that, and it's the best piece of advice I've ever been given. And then other people, understandably, it's very distracting having your legs tied together. So if you can mentally get past that, then that works really well. Other pillows, having one between your ankles is quite nice, because it just helps keep everything in that nice sort of alignment. And then the pillow I mentioned, a normal pillow turned the opposite way and under the ribs and hips is really helpful as well. And then for women suffering from lower back pain, getting another pillow and so lying on your side, and then kind of wedging it behind that lower back to support it, so those muscles turns off and it gives them a chance to relax. Other advice, I'm really big into exercise, and this varies per person. Obviously, what you're capable of at 5 weeks, if you're suffering with morning sickness, is not much. If you are feeling good, then, and you've been doing exercise, then keep going with it. The general rule of thumb is, as long as something feels like good pain, like, yes, I'm lifting a weight and it should hurt my bicep in the way it's hurting, then that's fine. If something feels, oh no, I've gone a little bit too far and now I've got the sciatica down my leg, or my pubic joints now quite sore, then you just tweak exercises to suit how you're feeling on the day. So, normally you do squats, but today, every time you do a squat, it's quite painful. Then just refine it, do a little squat, and, does that feel okay? And then also, if you've been lifting weights are fine, weights are great. But again, does this feel like good pain, or is it starting to feel too much? And just judging it per person, ideally with a personal trainer, or just doing 1 or 2 sessions every now and again, just to touch base and just check everything you're doing is correct. And then more towards, I've had women who are 40 weeks and are still doing exercise. And it just comes down to just doing more body weighted exercise. Don't be lifting a 30 kg something, but whether you're in a pool going for a swim, or you're going for a walk, or there's lots of amazing yoga, pregnancy yoga classes, or Pilates, or there's Lorraine that we know, she does a lot of pregnancy and postnatal, she's a PT. So I think, especially going back to the relaxin hormone, because it makes all your muscles and ligaments and things all floppy and lose their tone, you really, in pregnancy, to support those joints and things and that growing belly, it's really important to keep that exercise going if possible. Another topic for me is belts, like pregnancy belts and things, which kind of ties into the exercise, where I generally don't suggest them straight off, depending on where the person is. So if you're early into pregnancy or in the second trimester, I'd probably say, let's leave it for now. And because the problem with the belt is it does the job of your muscles for you. So if you've got a bit of lower back pain, it's a little bit niggly, but you're okay and you're only 22 weeks. Then if you go put a belt on, all those muscles, even more so than the relaxin hormone, then turn off. Just the same as if you break your arm, you put it in a cast, 6 weeks later, you've got one really skinny arm. It's the same thing. Whereas I've got a couple with pubic joint pain who they're still having to work, they're still doing lots of things that they can't avoid at the moment. So I'm like, okay, let's put on a pregnancy belt with the support of pubic belts. on that sort of person, then absolutely they need that relief. Like one's a teacher and she's having to walk backwards and forwards down to school, so it's just practically for her at that stage, it's just not, we're not going to be able to get on top of it fully, and a belt is appropriate. Whereas earlier, and I'm like another comment on brands, not that I like talking about brands, but like the Smiley belt a lot of women buy is not supportive. Like they're made out of wetsuit fabric, which have too much give. And if you are wearing a belt, they need to be actually quite rigid, because if they're too elastic and too much give in them, it's, again, the whole point of the belt is to help hold you together and support it. So those ones I find, if you are in that 22 weeks, you're only 1 or 2 out of 10, then that probably would help that kind of person. But again, it's not the point of a belt. A belt is to artificially hold you together and do the work of those muscles and help hold those joints together that have now got too much flexibility. Yeah, I think that's kind of covered everything. Any questions or other things you'd like to add?
I have some questions, quite a few, so I can just run through them. So I guess if you're a first time mum or whatever, and you've never been to an osteo or a physio or whoever, what should a mum, like a pregnant mum, look for in a practitioner, and how do they know who to see in relation to their niggles that they may be experiencing?
Generally, no matter which profession you choose, whether acupuncture, physio, that ideally someone who specialises in pregnancy, just because there's the hormonal component, there's postural changes and things. Like at uni, we didn't learn too much about it, and I've done lots more, like my sister's midwife, so I have one of her textbooks, I'm doing online courses and things, and just learning that little bit more of the anatomical and the hormonal changes and things like that. In terms of just actual profession, it kind of comes down to, some people go to a chiropractor and love being clicked, and some people that's quite mental as well, like until they hear that click they don't feel they're better. It really just depends, and sometimes that's not me. Sometimes they do prefer an acupuncturist or a chiropractor or something else, and that's totally fine. How you make that choice is up to you. Like I have a video on my website that shows people from start to finish what to expect, whether you're a general patient or a pregnant patient, just to give people a kind of idea of what to expect. But yeah, just someone with background that specialises in pregnancy and postnatal, and then per profession, it really comes down to you and what you get the most benefit out of.
Okay, and just curious around you saying someone who specialises, do you know what the, I guess, rules are in New Zealand about people who claim that they can work with pregnant people? Are they actually qualifications, or like, I'm just curious, because I don't know if anyone's like, oh, I'm a physio, but I work with pregnant women. It's like, is it the same as you've actually trained to be able to do that? I'm just curious if there's anything.
No, well, I don't know about the other professions, but like for us, we've done a bachelor's and a master's, of which pregnancy was covered, but just not to the extent, hence why I don't treat children either. It wasn't treated taught depthly enough. But as an osteopath, is there any regulation or extra boxes I have to tick to say that? No, there actually isn't. Okay. And I don't think any do. The only one we have to do, which we had to do, we all had to do, was some courses out of a university in Dunedin, I think it was, on childhood. That otherwise, that's just on our APC that we can't treat under a certain age. I can't remember what age it was, but we all just did it. But we're all highly regulated is the other thing. So compared to some other professions, so an osteo, a physio, chiro, acupuncture, we are all highly regulated, just like a doctor. We have our own council and things like that. But yeah, kind of further, that really come down to the individual, but you could easily ask the practitioner what they've done. Yeah.
Okay, that's cool. Also, because I'm assuming you work in a private practice. Is that correct to assume?
All in a private practice.
Yeah, I'm just curious as to the difference between private care versus going through the public health system, just because obviously I've been in my last pregnancy, I had SPD, and now I've got SPD and the sciatic. But I've heard things that it's best to go private because the public health sector doesn't really achieve much for women who are actually truly suffering. And I was just wondering what your perspective was on that, if you knew anything around there.
Hard
And
to
you might
say.
be biased, but just curious if you...
No, not at all. I haven't, because I am in private practice. Where I am is downstairs is a GP clinic, and then upstairs there's the women's physio, there's the other osteo. It's a very multidisciplinary clinic. Therefore, it's hard to compare because I don't know the public system. You can get referred through your midwife and GP to see the hospital physio, which I would assume then is free, compared to mine, which is not. We as osteopaths, same as physio and chiro, you are, if it's an injury, you are partially covered under ACC. And again, that also varies. Osteopaths, generally, a third of the treatment is covered by ACC, and then the rest is actually paid by the patient. Some physios, even though we pretty much all get the same money from ACC, they will treat you for free under ACC or $20. So it is a cheaper option from some people. But in terms of the public system, I haven't been through it myself, and that doesn't apply to my profession. In fact, it only applies to physio. So I couldn't honestly answer that either personally or professionally.
Right, no, that's
For
cool.
anyone that doesn't know what SPD is, can you explain what SPD is?
So that's symphysis pubis disorder. So it ties into, again, to what I was saying about the front of that pelvic joint. So you got at the back, you've got the triangle bone of the sacrum, you've got the little coccyx. Between the sacrum and then the actual pelvis is the sacroiliac joints, and as you come around the front, that's the pubic joint. So it's just dysfunction. So whether sometimes it can move up a little bit, or one of the bones can twist a little bit, or it separates that little bit too much. If there's a leg length discrepancy, then that's when it can cause an upshift or downshift. And it's effectively, it's just pain in the pubic joint in the simplest terms. Yeah. And then pelvic disorder more refers to somewhere in the entire pelvis. And sometimes, though, you can have pain on the back, which refers through to the front of the pelvis, or vice versa, or down into the legs and things, which often happens with that pubic joint. You can get pain referral down that inner thigh. Yeah.
Cool. And just jumping back to the private versus public, do you have any tips for mothers who may not have the means to pay for private care? And because the problem with public, because I just got referred this time around to public, but I'm going to go private again anyway. But for people who can't afford to pay that, because, I really respect all of the professions and what they do, but it can be quite costly for some people. And so I'm wondering, not to say don't go private, but for people who genuinely can't pay, is there anything else they can do besides going on the public wait list? Because I got referred over a month ago, and I still haven't heard anything. And pregnancy's obviously got a time span on it, so you meant to just suffer for months, and then they contact you 3 months after the baby's gone. Oh, we can see you now. And you're like, oh, thanks, but no thanks.
And that's like mental health services is exactly the same. And this is the problem. Like mental health is a prime example of the same, but far worse, is that you get referred under the public system. And it's, and that there, I don't know, other than just ringing them yourself and explaining, or just, saying how much pain you're in. Like even my son, he's under specialist care for, we've got health insurance for him. And then it depends on the profession, because we had to see a dermatologist, which I could have seen privately or publicly, but it was actually faster to see her publicly than it would have been privately. But then his ear, nose, and throat specialist, it was easier to see him privately under health insurance. So it's a system issue. It's nothing I can change. other than relaying your case and bringing them yourself and kind of hounding them. And this is where women unfortunately fall through the cracks, that they end up suffering their whole pregnancy, which means, their mental health deteriorates. They can't necessarily work their whole pregnancy, where if they had just had a couple of sessions when they were 22 weeks, when this first started or whatever, then now that they're 36 weeks, that time period would have been so much more enjoyable, and they could have achieved so much more. But the systems let them down. And this is this whole issue with, and the healthcare system is overloaded.
100%.
And that's across the board. That's not isolated to anyone, which is, sometimes if it is an ACC injury, you can definitely sometimes still find physios that work for free under ACC. So if money is a barrier, that you could try Googling and researching that way.
Okay. Any other like free resources or good websites where they can get tips and tricks, or I don't know if you know anything off the top of your head, or even if something comes to mind and you can send it to Helen, just it's nice for people to have somewhere to go if they're desperate, that you can point them and be like, look, I know you can't afford this and I know you're waiting, but have a check this out in the meantime or something.
Yeah, absolutely.
Sorry, I have one more question and then I'll stop hogging your time. Do you ever offer, or I mean, I suppose you can't offer, but like suggest chatting to the GP or midwife about pain medication in conjunction with treatment, or do you just deal with the, I guess, like as you've said, what you deal with? Like, do you ever suggest it for anyone?
Legally, I can't even tell you to take Nurofen. I can say go speak to your pharmacist as a non-pregnant person, and you can have and ask them if they think Nurofen was appropriate, or Panadol in a pregnant person's condition. Depending on the person, then I would totally, whether it's iron, whether it's omeprazole for reflux, whether it's something for constipation, I will easily consult with obstetricians, midwives, GPs, write letters on their behalf and just say, patient X is a number of weeks pregnant, they're struggling with this, treatment's doing this much, but I think she needs, what are your thoughts on pain relief options? Or can you think, or if it's just omeprazole, like the midwife can prescribe that. Not happy to say to the patient, look, just ask her for this is what you need. Things like that. But we cannot prescribe. I would never put words in a GP's mouth and say, can you prescribe this?
But suggest for the patient to seek out extra
all the time.
Okay.
And even just on a general basis, like one of my male patients, he has been having blood in his stools, which he thinks is from hemorrhoids. It could easily be colon cancer. So I sent him back to the doctor and I said, look, how long has this been going on for? There's no other signs, and it could quite possibly just be hemorrhoids. But at the same time, that GP has now since then put him on one type of medication for the bleeding, but also referred him for a colonoscopy. So that is, and this is where that comes back to what you were asking about, our knowledge and background and specializing in pregnancy. And that out of that 5 years, like we have to learn every single, normal medical conditions that. In my case history, I ask you about how many times you do stools, is there blood, mucus, hemorrhoids, is there a history of bowel cancer? Because he's a prime example, I am the medical practitioner that picked up blood and stools is not good. You need that looked at to rule out cancer. Wasn't my exact words, it was much more delicate than that. But you need to be able to pick up red flags. Just the same as, so for myself, I had back pain when I was pregnant with Ryan, and it actually turned out to be a kidney infection, even though I didn't have any UTI symptoms. But if a patient comes to me and they're saying I have back pain, it's roughly in the kidney area, I need to make sure I'm asking her, do you have any changes in urine? Is there any burning, smell changes, color changes? Especially because UTIs are so common in pregnant women because of the progesterone hormone. It makes that whole area of that underside of that pelvic region, it makes all that soft tissue extra soft, which means bugs easily go up there. So when I'm pregnant, I suffer a lot from UTIs, and for me, it goes straight to my kidneys. So you need to always ask the right questions. Same as headaches, there's lots of red flag symptoms. I had preeclampsia, so I'm personally very big on swelling and blood pressure, and getting that routinely checked. And I will happily send a patient back to an obstetrician to have that checked over. Yeah. I can't remember what your original question was. I felt like I went on massive
No, it was
tangent on
good.
that.
You answered the original question, so that's fine.
Awesome. Any other questions before we go? Thank you so much, Sarah, for your time. You gave us so much information, some really great little tips and tricks and all of that. So really, really appreciate that. And so just to let you know, Sarah's based in Milford in Auckland. And I will be I'll pop this recording into our group for anyone else who wants to watch it. And obviously, if anyone here wants to watch it again. So thank you very, very much.
Oh.